Hello everyone, and welcome to my presentation for image criteria image analysis on AP Abdomen. So first we're going to talk about how you position for an AP Abdomen. It's quite simple. For an AP Abdomen radiograph, the patient can either be supine or erect, but for this presentation I'm just going to focus on the supine position because the central rays are slightly different. The patient must be dressed properly, as always. Any materials that can be an artifact on the image have to be removed, so pants with buttons or zippers or thick elastic that can show up, and if female patients have bras with clasps or underwire, those will also need to be removed. Once the patient is lying on the table, you have to ensure that their shoulders and their hips are aligned directly on top of each other and that their arms are off to the side. You just want the MCP and the MSP to be perfectly aligned. Okay, for the central ray and the collimated field for an AP abdomen is going to be open at a 14 by 17. However, not all patients are going to need that, so you can collimate down to an inch on both sides of the abdominal wall. The MSP is going to be perpendicular and the MCP will be parallel. The central ray for an AP abdomen is going to be at the MSP at the level of the iliac crest for female patients, and then for male patients it's going to be 1 inch inferior to the iliac crest. Image criteria for an AP abdomen. So you want the spinous process to be in the midline of the vertebral bodies, pedicles at equal distance. The iliac wings have to be symmetrical and in line with each other. The sacrum should be centered within the inlet of the pelvis and aligned with the symphysis pubis. The long axis of the vertebral column will be centered, or should be centered, on projection. The fourth lumbar vertebrae is going to be at the center of the exposure field, which is in line with the iliac crests. 12th thoracic vertebrae, the lateral body, soft tissues, the iliac wings, and the symphysis pubis are included within the exposure field. The diaphragm domes are located superior to the 9th posterior ribs, so they don't necessarily have to be in the image. First, we're going to talk about, we're going to critique a low quality image. So we've got this image here. Not everything that should be included is included. So the first thing you notice is the central ray is completely off. It looks to be about 3 or 4 inches above what it should have been. Second, the pubic symphysis, it should be present, but the bottom half of the pelvis is completely clipped off, so the anatomy that should be included is not there. So a way to correct this image would be to adjust the central ray. Everything as far as MSP and MCP looks really good. Their central ray was just off, so necessary anatomy was clipped. And then we're going to talk about high quality image. Now this image was the only one out of our stock photos that I could find that looked like it fit the criteria. I know the technique isn't very good, but still the pubic symphysis is included. The iliac wings are symmetrical, they're in line with each other. Let's see, the vertebral column is completely in the center. The fourth lumbar vertebrae is at the center of the exposure field in line with the iliac crests, and the diaphragm domes are located superior to the 9th posterior ribs. So this is pretty much what you want your AP abdomens to look like. And then it's question time. So these are quiz type questions that you might get about an AP abdomen. So first we have, what breathing instructions should be given to the patient for an AP projection? You want them to suspend respiration after exhalation. So tell them to take in a deep breath, blow it all the way out, and hold it out. Number 2, for the AP projection with the patient supine, which structure should be seen at the bottom of the image? That would be the pubic symphysis. The reason for that is so that you can include all of the bladder. What is the advantage of exposing abdominal images at the suspension, after respiration, and AP projection compared with the respiration of suspension after inhalation? So you want to do that so that the abdominal organs are not compressed. If you have a patient breathe in and hold their breath, it's going to compress the intestines downwards, and that's not going to get a good diagnostic image. So you want to make sure that the diaphragm is up so that the organs are completely projected the way they need to be. And that is it. Thank you guys.